I'm not sure where to begin with this story, and this is a little different video than I've typically made on the channel, but I feel like this is important to cover. There has been a decline in trust in the medical system over the last few years, and we can see that by surveys. And stories like this don't make things any better. William Bryan was a 70-year-old man who was vacationing in Florida. During that time, he started to experience pain in the left side of his abdomen and went to the hospital, as one would when they got something going on. During his stay in the hospital, he had a CAT scan and a physical exam, likely in the emergency room, that confirmed that there was some bleeding around the patient's spleen. Generally, when this kind of thing will happen, they'll consult general surgery because general surgeons are the ones that deal with the abdomen to determine if surgery was needed. The surgeon here is Dr. Thomas Shachnovsky. Dr. Shachnovsky had told the patient that due to this bleeding, it would be unwise for him to travel home to have a surgery to remove the spleen, but that's what he needed to have happen. So the patient was admitted to the hospital under the care of Dr. Thomas Shachnovsky and scheduled to undergo a removal of the spleen. In medicine, we call this a splenectomy. The spleen is an important organ and it can be enlarged during cases of metastatic disease like leukemia, lymphoma. When I'm doing an exam on a patient who has a history of metastatic melanoma, or even any melanoma really, I'll palpate their lymph nodes in their neck, under their arms, and I'll also push on their liver and their spleen, because if those are enlarged, it could be a sign that they could have cancer spreading somewhere else in their body. Now, the tragic part of this story is that the patient was taken to the operating room and allegedly Dr. Shachnovsky removed his liver instead of his spleen. Now, the general public, I think, will rightfully know that the liver is on the right side of the body. Now, you may not know where the spleen is, but the spleen is on the left side of the body. Any doctor should know this. This is some of the most basic anatomy that you would ever go through. When you're going through medical school, you're going to take anatomy. The liver is very easy to identify, and the spleen's a little more difficult to identify, but it's tucked in there, and unless it's really enlarged, you may not really see it real quickly. But if you're a general surgeon, you know where this is. This is your bread and butter, is operating here. We're going to talk about some of the things that went wrong here, because obviously this doctor, if the allegations are correct, was probably more than just negligent. Certainly this is not just medical malpractice. Something weird is going on here, and there's more details going to come out. We're also going to talk about some of the systemic problems that may have contributed to this, and we're going to look into Dr. Shachnovsky's CV, look at where he trained, and understand how this could happen. Now, I went looking for Dr. Shachnovsky on his practice website, and not surprisingly, it was largely scrubbed already. Any group that he was associated with or hospital he was associated with would have removed his profile from their page by now. But I looked in the Wayback Machine and found one from 2023. There was another archive of this page in 2024, but it had also already been scrubbed. In doing some research, I found out that this is not the first time that Dr. Shachnovsky has allegedly operated on the wrong site. Back in 2023, he was scheduled to remove a portion of a patient's adrenal gland. The adrenal gland sits right on top of your kidneys. You have one on each side, and it produces corticosteroids, it produces adrenocorticoids, things that help regulate your blood pressure, your stress hormones. And it sounds like instead, the patient had a portion of their pancreas removed. Now, the pancreas sits up higher. It's usually tucked right under the stomach, right kind of next to the liver. It's not going to be touching the adrenal gland. They're in different areas. So this was another case of medical malpractice, and it sounds like that was settled out of court, where the details of the settlement were not disclosed. So I don't have any information to go off on that. When we look at Dr. Shachnovsky's resume, it says he is board certified in general surgery, and he was affiliated with the Florida Fort Walton Destin Hospital and the Florida Twin Cities Hospital. He got his undergraduate degree from Loyola University, and he did his medical school at Midwestern University in Illinois. He then went on to do an internship and a residency in general surgery, and this says he did a fellowship at Hackensack University Medical Center. Now, it did not say what that fellowship was in, but through other research, I'm led to believe that it was a colorectal fellowship. So this means that he would be expert at operating on the colon, the rectum, the anus. These doctors do a lot of colonoscopies and deal with problems of the bowels, but they also will still be doing appendectomies, they'll be doing gallbladder removals, they'll be operating on anything that a general surgeon would, and then they would do a lot more of the colorectal type stuff. So this should still be in his wheelhouse as a general surgeon. I just wanted to share his care philosophy from the website. It says, superior results are achieved by a combination of strong interpersonal relationship between patient and surgeon, superior surgical skill, and prayer. I'm not really going to comment on that, but I just wanted to share it. So let's talk about the systemic problems that happened here. When a patient goes into surgery, they are not only in that room with the surgeon. There are circulating nurses, there are assistants that are the first assist, the second assist, there's an anesthesiologist, and I have a hard time understanding how this patient could be having the right side of their body operated on and nobody's saying anything when everybody in that room should know that you're having the spleen removed, which is on the left side of the body. Every surgery should start with something called a time out, and this is a standardized practice that has been shown to reduce medical error, because before the patient is ever cut on, they go through the timeout where you talk about the patient's name, their date of birth, what surgery is being performed, what allergies the patient may have, what medications they're currently on, and depending on the unique nature of that case, you may have other details in there. But that should always be done. So everybody in the room knows what is going on in that room. So everybody should have known the patient was there to have their spleen removed, which is on the left side of the body, not the right. Also, before you take a patient back to the OR, you go see them in the pre-op area and you mark the site where surgery is being performed. I will occasionally do surgery in a surgical center for patients that have large or complicated tumors on their skin, and I always would go in with a purple marker and circle the area and write my initials on it, confirm the name, the date of birth with the patient, and ask them, what procedure are we here to do today? So that everybody knows what's happening. So these are systemic things that have been implemented to prevent this kind of error. Some general surgeons, and I can't speak for Dr. Shachnovsky, I don't know what his attitude was, but especially back in the heyday of medicine, general surgeons weren't always perceived to be the nicest people, and they would yell a lot. Sometimes they'd throw things. So I'm curious to see if there's something here where his personality was such that people were afraid to speak up against him. Because if that's the case, that's a systemic problem that needed to be rectified as well. If a surgeon is completely non-approachable, especially when they're about to make a grave error on a patient's life, then that surgeon shouldn't be operating there. Now, as far as how a general surgeon who presumably had a fellowship could not understand where the liver versus the spleen was, is beyond my comprehension. Reportedly, after removing the liver, he commented that it was 3 to 4 times bigger than any spleen he'd ever seen. And he labeled it as spleen on the specimen table. And of course, the pathologist, when they got the specimen, clearly knew it wasn't a spleen. When they did the autopsy on the patient, they found the spleen, found that there was a small cyst in there that probably could have waited until the patient got home to have that cyst removed. So there's so many errors in here, and I'm very curious to see what details will emerge additionally. Clearly, the family is going to pursue civil litigation against the doctor. The doctor is very likely to lose their medical license and potentially face criminal charges. In the state of Florida, there's a long process before a malpractice suit can be brought, and so the family will go through that process. The medical board will take time to do their review, and there are good things about why medical boards move so slowly, because sometimes there are doctors who are falsely alleged to have done stuff, and you don't want a medical board that just has the power to revoke licenses willy-nilly for political or personal reasons, but you want thorough investigations, and in cases like this, it's natural to wish that they could move a little more quickly, because if the doctor could make this egregious of an error, probably shouldn't be operating on anybody. And I think we're going to end up finding more and more about this story, just like we did with Dr. Death down in Texas. Not trying to compare the two, but once things started to come out on Dr. Death down in Texas, there's a neurosurgeon, more and more stories just kept piling out. This doctor had had a history of wrong site surgery. This is the most egregious case of wrong site surgery I've ever heard of. I won't be surprised if we end up hearing more. My thoughts and prayers go to the family of Mr. Bryan, who should never have to go through something like this. Guys, thank you for watching. Leave your comments down in the video, and I'll try to answer as many questions as I can about this case and bring you more news updates like this.